Now, Professor Abdul Salami Nasidi is Executive Director, ECOWAS Regional Center for Disease Control, and he joins us now from our Kano studio. Welcome, Professor. Thank you for joining us on the program. Let's begin with the cases we're witnessing in the region. What's the COVID-19 response at the sub-regional level?
Good afternoon, but I must correct the impression. I was the first or pioneer executive director of the ECOWAS regional CDC, but I'm no longer the executive director. I'm now the provost of College of Health Sciences, University of Africa in Tororo, Bayelsa State, and also advisor to the Honorable Minister on COVID-19. Nevertheless, generally the incidence or prevalence of the COVID-19 in the African continent is something that is of interest to the whole globe, and we are, to say the least, we're much luckier than most of the other continents, and the spread of the infection seems to be a little bit slower, or our ability to actually test and establish the true situation is not very strong. Nevertheless, most countries have now increased their capacity to test, and we are seeing more and more cases and few more deaths coming.
What are your thoughts on Nigeria's response? In the midst of it all, we've imposed travel restrictions, yet we're witnessing a lot of abuse on people still traveling, and we're still seeing cases by the day of the virus. Do you think that our measures, our partial lockdown ease, is working?
It's very difficult to assess. Unfortunately, it's not working as we would have loved it to work. And this is the fact that some of the measures taken were not evidence-based, were not based on some scientific findings. The virus has escaped into the community, and the approach to actually, curtail the transmission of that virus within the community is a little bit different. At the same time, of course, unfortunately, in many of the communities in the country, we have not attained 100% acceptance. Some of the communities, some of the states are still in denial. So enforcing the restrictions, the lockdown, have not been effective, very effective as in other places. I wish many states could have copied from Lagos in particular and Kaduna State as far as lockdown is concerned.
But apart from all of those measures, what more support do you think that the NCDC and the EOCs need to indeed curtail the spread of the virus?
Well, as you know, Nigeria with about 200 million population, the NCDC staff strength now needs to be fortified. Also, the capacity to carry out the following activities must be, increased many times so that they could actually meet the challenges of the high transmitting areas and to prevent those areas transmitting more viruses to currently low transmitting areas. One is to ramp up the capacity to test, which the NCDC is currently, doing, and two is to expand their capability to assist states and local governments to actually carry out effective case search, active case search, contact tracing, and of course, isolation and treating of the patients.
All right, we appreciate your time, Professor Abdul Salami Nasidi. We do apologize earlier for the error, but you are the first pioneer. We appreciate your time. Also, the Provost, College of Health Sciences. Thank you for joining us.